I was happy to join Children's Health last week at their symposium on AI in healthcare, where they learned how LLMs work, debated the pros and cons of AI, and pitched AI solutions to pressing problems. As I meet with people across campus, I'm listening and learning, and I'm thinking about what role health informatics plays in the UT Southwestern strategy. To answer that question, we have to answer a fundamental question. What is health informatics? I'll first share my favorite definition. Informatics is not about technology per se, it's about information. It's the science of how to represent information, how to process information, and how to communicate information in both natural systems, humans, and artificial systems, computers. It's about how information is communicated across all of the entities involved in delivering care. That means informatics is computational, but it's also cognitive and it's social. That's really big. A key model in thinking about informatics is the pyramid where data moves up to information, then to knowledge, then to wisdom. In healthcare, data doesn't save lives, as Chet Friedman likes to say, but knowledge and wisdom do. I asked 4 people working in informatics at UT Southwestern what informatics is to them. Justin Rousseau is Deputy CMIO of Neuroscience.
So informatics to me is how we can use data, healthcare data, to support clinical decisions, answer questions, where the ultimate goal is to improve human health.
Leveraging data to support clinical decisions may sound simple, but it takes a lot of work to get the right data to the right person at the right time. Angela Carrington is the manager for clinical decision support.
Imagine a lake fed by countless rivers and streams where every drop of water represents patient data. Medications, vital signs, lab results, social determinants. Clinical informatics for the EHR, Clinical Decision Support Team, and Regulatory and Quality Team works like we are the stewards of the lake. We ensure the water is clean, data quality, that it flows in the right channels, integration and workflows, and that it nourishes the ecosystem around it for clinicians, patients, and the health system. When managed well, this lake of information becomes a reservoir for clinicians to draw from at the right time, in the right place, to make safer, smarter, and more compassionate decisions.
Here's what Sam McDonald, CMIO of hospitals, says about the role informatics plays in that relationship between the person and the computer.
So I think informatics to me is the understanding of how the user and our medical information system interact with each other. And I think, as kind of operational informaticians, we try to leverage our information system to make it easier to provide care when delivering care with our users, which are clinicians.
Scott Minnerly, Director of Clinical Decision Support and Electronic Medical Records, reflects on the role of informatics and how we move from knowledge to wisdom.
What informatics means to me is the ability to use discrete data to improve our healthcare knowledge and wisdom so we can better take care of our patients. And this happens through either research, best practices, or identifying patients with rare disease states and comparing them across the universe.
I started by saying informatics is big. Well, here's a diagram by Jiajie Chang, the Dean of the School of Biomedical Informatics at UT Houston, and it captures the breadth. You can see the processes that transform data to wisdom or intelligence, the domains that apply informatics techniques to improve health, including research, healthcare delivery, and disease prevention. Well, whether you agree or not with the representation, what's important from my point of view is, number one, health informatics needs many types of expertise. I come from linguistics. My son's an informaticist who came from jazz piano. People come into the field from medicine, nursing, engineering, math, sociology, psychology, statistics, anthropology, you name it. And we need all of those insights to accomplish the bold goal of achieving intelligence to provide better healthcare and achieve better health. Have you noticed how everyone's an expert in AI and that now that we have ChatGPT? So my second point is, similarly in informatics, although you and I can have some level of understanding across the entire field about what needs to be done, knowing how to do it takes deep expertise that no single person has. So it's really important as we embark on a strategy for health informatics at UT Southwestern to be humble in what the best solutions are, and instead focus on defining the problems we want to solve and on what we want to achieve. Then we can rely on those with deep expertise in the how, like Angela, Scott, Justin, Sam, and others, to help us define how to get there. Next week, I plan to take a deeper dive into clinical decision support, which is a key mechanism for turning knowledge into action and wisdom. The Huskies have been shedding like crazy since we got here, and there's nothing Kari likes more than a good rub in the bushes.